All right. Well, we'll go ahead and get back started. For all of the attendees online, I just want to plug the fellow presentations that'll occur at the end of the day. We have 10 fellows that'll be presenting. They're going to give quick 6-minute talks on cases or topics of their choice, and we'll have a little competition. So there will be a survey for you to vote on the most effective presentation. So definitely stick around for that. That'll be from 4:30 to 5:30. So we will move on with our day, and I have the pleasure of introducing Matt Gammons. Dr. Gammons is a primary care sports medicine physician in Vermont. He's a member of the U.S. Ski and Snowboard Physician Pool and medical director for the Killington World Cup ski race. He serves as medical control for Killington Mountain Ski Patrol and is a past president of AMSSM. Dr. Gammons does a lot in the way of fellow education. He has fellows from 6 or so programs that rotate him every winter, including some of the fellows in this room. And I had the opportunity to spend some time with him in Killington. And he is going to give us a talk on ski and snowboard medicine. So, Matt, take it away.
All right, thank you, everybody. Hopefully, I'm coming through okay there. Ben, can you just give me a thumbs up if everybody's hearing me okay there?
Yeah, you are all good.
Okay, perfect. So, wish I could be there in person. Turns out that life's just a little too busy. So, I'm going to go through a few basic things here in terms of skiing and snowboarding, then hopefully give you a few pearls for those people that might be interested in doing some coverage things. So I think Ben went through it. Mostly what this slide tells you is how old I am, how long I've actually been doing this kind of thing on the mountain. But it's something that I spend all winter long covering, whether we're covering the clinic on the mountain or some of the events. So at least I hopefully have learned a few things over the years in doing that. So if you want to fall asleep, this is really the take home slide. And after that, you could probably get up and I know you just had a break, but basically, all these sports are very unique in that you can have very low energy injuries and you can have very high energy injuries. So sometimes determining sort of that on its own helps you understand what you need to look for and what other things you might need to send somebody off for. And then there's a lot of terrain issues that both involve my ability to get up and down the hill. And I will tell you, one of the scariest things that I do when covering, particularly the World Cup ski races, the Alpine races, is actually trying to get down the race course because it's a solid sheet of ice. So it doesn't look good if the doctor falls and hurts himself. It doesn't certainly instill confidence in the athletes you're trying to take care of. But then obviously there can be a lot of communication issues. I was just covering an event in Canada and way up in Quebec, and we had some cell phone issues, so we had to kind of work around that. So the other thing I will say, if you cover these events, particularly downhill or alpine, but certainly even any of the freestyle events, you really want to make sure that nobody else is coming down the course above where you're entering to take care of an injured athlete. And there's usually protocols for that, but the last thing you want is to have somebody come crashing down, and now you got 3 people that are hurt, not just the athlete. Now your medical staff is hurt as well as potentially another athlete. So what are the basics? Many of you probably know this, but we look, the numbers vary, but you're looking about, somewhere around 350 million skier days. Skier day just means somebody showed up on the mountain and had a ticket. It's not a great sort of way to track injuries in terms of incidents, but it just gives you a sense of how many people are out there. The governing international body is FIS and then USSA in the States, and then there's a few other ones. And then just for sort of levels, the World Cup is what you'll see next month at the Olympics. These are all pretty much World Cup level athletes. And then in North America, you have the NORAM Cup. In Europe, you have the Europa Cup. And they're pretty much anything below that is broken down by age group, but some of the older age groups may participate up depending on skill level, such as, Michaela was skiing in the World Cup, I think pretty much when she was 16 years old. And then the freestyle events, have varieties and really don't have quite the same age groups. And you'll find actually when you look at sort of the birth dates on some of these athletes, they're going to be in particularly the snowboarding side, but the free ski side, it's quite scary how young some of them are and how skilled they are. So the alpine equipment, we used to talk about traditional ski versus parabolic or shape ski. That's pretty much everything's a shape ski now. So, but just know there's some, basically all that means is there's curve to the side. The biggest impact that has had is that it lets a less skilled skier apply more force to the ski. That's the upside, is that you can actually make carving turns better and do things. The downside is it kicks a lot more force back at you. And so we actually see with our ski academy, our younger kids, a lot of overuse injuries related to just the repetitive force that comes back up through the snow. There's not too many sports. Yes, you use ground reaction forces in field sports, but in skiing and snowboarding, the inconsistency in the snow and the gravity and the storage of the energy within the board and the ski kicks a lot of force back up the chain. And so athletes sometimes have trouble controlling that. So snowboarding hasn't changed too much in terms of the equipment and the shape. There is some variety, particularly if you use there's carving boards, which are a little bit more like a large alpine ski. But basically you're fixed into 2 points and then you can go goofy or regular depending on which foot you go forward. And The competition levels are different, but one of the big differences is there's a lot of stuff in both free ski and snowboard that are outside FIS and USSA, the Revolution Tour, the X Games, which you may have seen on TV. So there's a lot of different moving parts sometimes when you're covering these athletes, depending on where they are. Equipment, I think it's important. So those of you that are familiar with skiing, but there's something called a DIN setting. I will not try to pronounce my German, but basically what that is, it's taking into account in the binding of how heavy you are, how good you ski, and a few other things such as your boot length to try to set the binding to try to keep you from breaking your tibia. That's really what it's set for. I think there's some, I know with a lot of people that come into my clinic when they're hurt, they feel like sometimes the binding didn't do its job when they hurt their knee. But to be honest with you, the knee is a cost of setting the binding in such a way that you're protecting your tibia, but you're also not kicking out too early. Most of the elite skiers pay no attention to what their DIN setting is supposed to be. They just crank it down as much as possible. Typically, the speeds or the heights in which they're participating, they don't want to come out. That could be more dangerous to them. But there is some correlation between the DIN setting not or the binding not working well and the lower leg fractures, but not knee injuries really. Netting for particularly the skiing events, you have two types of netting. It's really just to keep people from going off the course, into the trees, off cliffs, these sort of things. It does complicate sometimes the extraction of athletes, and we can talk about that a little bit because they can get quite tangled up sometimes. Sometimes we have to cut the net in order to be able to get athletes out, but just a little bit more if you're not familiar with particularly alpine racing. What we see in other sports, there may be some padding along poles and other things, but not quite the same amount of netting. So you got two types of events, just so everybody's on the same page. In alpine skiing, there's speed events, that's your downhill and your GS. They have the highest risk overall, probably because they have the highest speeds and the longest courses. So there's the most opportunity for injury. They can reach speeds of almost 90 miles an hour, certainly in the downhill. Downhill courses are tough to cover. So are giant slalom because of the length of the course. So if you're setting up a medical team, you have to have lots of waypoints, figuring out where should we stand, and if somebody falls, where are they likely to end up? Most of these have very, very steep terrain. So, if you stand at the top of a very steep fall, they're going to slide another 100 yards maybe down the hill. So you really need to be strategic sometimes on where you place yourself. The technical events, this is what we host at Killington. A little less risk of injuries, particularly serious injury, because you have slower speeds and more turns. Sometimes some of the rates show maybe slightly higher risk of knee injury in these because of the number of turns, but it just gives you a sense of sort of what these events are. Most of these are point to point. Slalom courses are typically short enough that you can almost see the whole run. GS, sometimes we have to have some waypoints just so that you visually cover the whole hill for injury risk. And then, of course, you have this wide variety of free ski, snowboarding, freestyle with a lot of crossover. There's a variety of forces that go into these, but particularly impact forces. If you look at the height that some of these athletes get in some of these things, I don't know how their knees survived the mogul courses and the free skiing. That's what I was just covering up in Quebec. But so you have to keep that in mind again when you're evaluating these athletes, sort of what was going on in terms of were they both coming down and twisting? Is it just impact? Or was it more just, hey, we just fell and slid? Because it really determines sometimes what actually happens to them. And then we sometimes cover adaptive sports. You will see in the Paralympics. The sleds are quite heavy. Certainly the recreational sleds are more heavy than what you're seeing here in the Paralympic athlete. But there's some equipment things that can certainly happen in that, and you see that big tumble there. So there's a lot of things that go on in those types of events that require even more sort of thoughtfulness in your planning, particularly in how we're going to extricate athletes that maybe have aren't able to help themselves in different ways because of whatever disability they have. So what injuries do we see? Well, recreationally, it still averages out around 3 if you look at sort of all the literature per 1,000 skier days. And again, that's not skier runs, that's not, or rider days. You can put that in there. Sorry for you snowboarders if it seems elitist. It's how the sort of the terminology is. The death rates have been about the same and steady, fortunately. So your severe injury rates haven't really changed very much. Typically related to head and sort of full body trauma. At the elite level, really most common thing we see is anterior cruciate ligament injuries in the knee. And then certainly with the free ski, you see a lot more variety in there, some of the upper extremity injuries, but it's not quite as well studied. But those are the types of things in ratio wise you're going to see. And obviously skiers, you're going to see more lower extremity on average, and snowboarders more upper extremity. The ratios kind of flip 2-to-1 both ways based on which one of those you're participating in. So what do we see for knee, right? MCL, ACL, the most common. The unique injury we often see is the plateau injury. The plateau injury comes from is a compression force. So as the skier is stuck in the boot and they're rotating over the top of the ski, the lateral femoral condyle or the whole femur, but typically the lateral femoral condyle will push down and sort of create an impact injury or a compression injury there. We really don't see that much isolated in other sports. It's an injury that some people can actually walk on depending on where it is. So we'll see people walk in our clinic. Sometimes you see much more severe plateau injuries. Those often involve impact or bigger forces. And then lesser sort of femur, hip, and ankle. It's a little counterintuitive, but you will see in boot ankle fractures a fair amount just because of the torsion. What's somewhat interesting is that typical Weber classification or the sort of the classification we use at the level of the syndesmosis, because in a boot and even so much a snowboard, you can't invert the foot. So you're getting just pure torque and like what we would typically think would be unstable, such as a level of a fracture above the level of the syndesmosis or your typical Weber C, often may be stable in somebody who did it in a boot versus somebody who did it when they sort of had that more traditional mechanism off snow. Upper extremity, shoulder, obviously quite a bit. Clavicle fractures are relatively common. In skiers' thumb in many studies is the most commonly sort of single injured part. I wouldn't say that we see that the most in terms of the clinic, although there's a wide variety of injuries that we see. The snow conditions tend to affect the upper injuries a little bit more. Some of this is studied, some of this is just my experience, but really, really firm conditions, you tend to see things break. They hit hard and the clavicle goes, the proximal humerus goes a little bit softer, a little bit twistier. You're going to tend to see some more of those kind of shoulder strains, dislocations, and some of those types of injuries. And then we see, of course, head injuries. Spine injuries are fortunately relatively rare. And some of that chest wall abdominal injuries, those can range from very minor to very significant. I actually had a C5 compression fracture walk into the clinic last weekend. My general rule with neck injuries at the clinic is either you don't need an X-ray or you need to go for a CAT scan. And of course, like any good physician does, I broke my own rule and took one and need a little C5 compression. I didn't send him for a CAT scan in that particular case, but just know these things can, these injuries can kind of present in different ways than we would traditionally think. And they, some of these people walk around, they have no neurologic symptoms. Some of the abdominal things, of course, we do see spleen injuries. Spleen injuries are less impact and more open slope falls versus your chest wall injury, which is usually a pretty good impact injury. The rule in skiing and snowboarding is the trees always win. So what medical issues do we see? Well, obviously, depending on when you're traveling, you can have obviously either mountain illness or what they just call altitude illness. Some people come to Killington, particularly from where you guys are, and think they don't feel well because they are at altitude. Well, we don't have enough altitude for that. Most part, I tell people from the city, it's the fresh air that's getting you. You might want to go stand out behind your car for a little bit while it's running, and you'll probably feel better once you get back to your acclimatization. Obviously, jet lag and travel fatigue, the typical sort of abdominal things that we see often when we're traveling to the southern hemisphere, which with the ski and snowboard team we do off season, right? So in the summertime, we're doing a lot of camps in the southern hemisphere. Cold exposure is an issue, but most of these athletes are pretty well equipped for this. Which we forget about is sun exposure, and the sun is bright. And some of our athletes are very proud of their goggle tans. I usually get a good golfer tan in the summer rather than a goggle tan in the winter. But particularly when you're, 10,000 feet, the snow reflecting off, don't forget for you personally that putting sunscreen on your exposed areas is very important because you can get burned really fast. Coverage issues. It's really going to depend on where you are. So if you're covering in Killington, if you're covering in Austria, if you're covering in some of these other places that have, excellent medical care relatively close, we're not we're not so worried about sort of the peripheries, but then if you're covering in Finland, north of the Arctic Circle, if you're covering Kazakhstan, if you're covering in South America sometimes, you're making decisions based on whether or not you're bringing a helicopter to get somebody off the mountain because there's no other way to get them down. Sometimes there's ski patrol. Usually there's some form of ski patrol, but I've been to a few of these mountain areas, particularly in South America, where there's really not sort of a very organized ski patrol. So all those things matter is sort of where pre-planning a camp. The ski team's gotten a bit better because they've more consistent in terms of where they're going. But for a long time, we'd show up somewhere, you didn't know what you were dealing with, and you really had to be thoughtful about, okay, what are we going to do if somebody gets hurt? Remember, your cell phones don't always work in the mountains. Certainly in Vermont, sometimes even sitting in my office where I am down in the valley, it doesn't work very well. And cold temperatures can affect battery life. So it's not that we don't use cell phones for some communication, but you got to make sure they work. If you have radios, you got to make sure that they're off towers most of the time. The site-to-site radios, certainly even on our single courses, which are not that long, don't work very well. So a lot of bigger ski areas obviously have the tower where they can relay signals, but you got to think about these things because it's tough, particularly at the longer courses where if I'm at the top of a downhill course, I might be 2 miles away from the finish. And so the ability to communicate with people down there. And obviously coordinating with whatever ski patrol you have, right? The rule is you're not always in charge. When I'm someplace else, like when I was just in Quebec, my job is really one to make sure that they're not doing anything really crazy that I think is going to harm the athlete, and then it's more to reassure the athlete and then help with the guidance of where they're going. When depending if I'm in Chile or if I'm in some of these other places that maybe don't have quite as much medical care, I might interject myself a bit more than I would like when I was in Quebec, or if you're in Austria or Germany or Italy and some of these places. Travel wise, I don't carry too much when I travel in terms of medications. Occasionally, particularly in South America, we'll take antibiotics that cover skin things and occasionally some of the abdominal things. I think some of you that have traveled, we really don't ever travel with pain medication. I will travel with local anesthetics sometimes. I highly recommend you pack most of it in there. The syringes can be a little tricky, but I've been lucky so far with that. And certainly suture and splinting material based on where we're going. If we're going like at Killington, the ski team doesn't even really bring their trauma pack because they know we have everything here. Again, if you're going someplace else, we've got a whole trauma pack that has a lot more things for coverage. But it's really something. I think the communication piece is key because we end up in a lot of these places. You don't know how it's going to go, and you're trying to communicate with coaches at the top or athletic trainers at the bottom, and figuring out where you're going to be and where you're going to stand, how you're going to be able to get to athletes. And often there's a language barrier, so you really want to try to scout that out as much as possible ahead of time. And then for you, again, we alluded to it, man. You got to be able to ski or ride at a level that's reasonable. There are some places where you can get away with it. In some of the particularly freestyle events like aerials, you can be just at the bottom and you don't have to ski. But anything you have to be on the hill, you should be relatively comfortable in your ability to get down. We have had to sort of guide some medical staff down sometimes. Even though I'm not great at running sleds, I've had to run sleds a few times to help medical staff get down the hill who maybe weren't quite prepared for what they were going to see. And then lastly, like I said, the course hold most of these through the radio channels. There'll be what's called the start stop, which can be slightly confusing, but it just means there's a stop at the start of the competition at the top to make sure that we're allowed to go on to the course. So we don't send anybody out just because of that danger of somebody else coming down on top of you, particularly with any of the events that are not line of sight. It's a little easier with some of the freestyle events where you can see both, like the half pipe, where you can see the top of the half pipe and the bottom of the half pipe. But just make sure you're safe. Make sure your team knows that they're safe before they're going to go onto the hill to care for somebody. I would also say it's okay with a lot of these ones with certainly big trauma. We maybe want to get there quicker, but a lot of these athletes will sit for a minute because they're very frustrated. They often can get up. I've seen people ski down courses with tibia fractures. They're often such good skiers. It's easier to do that than it is to try to load them on a sled. So you can often give these athletes a few seconds before you rush too much to them because they'll often get up even if they don't look like they're gonna. And then finally, prevention. There's not much in the world of prevention. These athletes, particularly at the elite level, you saw in some of the videos, there's high forces. They're hucking themselves in the air. There's a little bit for the rest of us in sort of the recreational world. The biggest advice I could give you if you're a skier is if your butt touches the ground, you shouldn't try to force yourself back up. Best thing to do is lay down and then get up and then keep going later. Basically, what happens, that recovery position, you load the back of the ski gets forced forward, and then you can tear your ligament quite easily. I mean, it's really impressive. We have lots of videos of athletes with almost nothing. They don't even look like they fall, but the ski catches, and before they know it, in a millisecond, the ACL is torn. So that's one thing I think that can sometimes help beginner skiers. I don't think it helps very much somebody who's trying to recover in a race course because they're going to do what they can to get down. Head injuries. Look, I don't want to say don't wear a helmet, but I will tell you helmet's ability to protect, most of these athletes and most people in these conditions is relatively limited. Some of the studies show maybe there's some help, although again, the standard definition of head injuries is not very good. So a lot of the older injury studies that we had that said maybe they're helpful, I'm not so convinced that that's true. In either case, I think it's just they have to understand the helmet's there as an impact protector up to about 20 miles an hour. It probably can do that reasonably well. Over 20 miles an hour, there's a lot of variability in the forces and what may actually get transmitted to the brain in terms of more severe injuries. There was a little controversy a couple years ago with a paper that came out of Dartmouth, actually, that I was participate in, but I consulted on a little bit, where they found that helmeted skiers and snowboarders were more likely to have higher trauma scores than non-helmeted skiers and snowboarders. And I'm not sure what it meant, but I think what it means is that the helmet is a one piece it's a tool that can help in certain circumstances, but it's just you can't just put the helmet on and expect that you're going to be okay if you're going 50 miles an hour and you hit a tree. So there's a few references here. The ski literature hasn't been updated a lot. It has at the elite level in the last probably 10 to 15 years, but not at the sort of recreational level. A lot of it came out of the University of Vermont, probably 30 years ago, even. So there's some room there. I think if anybody's interested in doing things, I'd love to have more time to do it, but at this point, I don't. So I'll stop there and certainly happy to field any questions now. I will try to stick around for the next break. I'm not sure if I can or not. Thank you very much.
Any questions for Dr. Gammons?
Look at that. I even did it in 20 minutes.
So, Matt, as you've been covering ski and snowboard medicine for the majority of your career, have you seen any changes to the injury patterns as both the technical skill of the competitors has increased and the difficulty of the courses that you've been managing?
I don't think certainly not so much at the elite level. At the lower level, I think we've seen two things: more large lacerations, and I think some of that comes from the ski tuning. Some of it comes from again our sort of I would say the U16, U18s, their ability to handle the forces that they're generating. They just seem to crash out more. So if you look at the finish rates, usually in let's take GS and slalom, you're doing two runs that are combined. We see the crash out rate a lot more than it used to be on one of those runs. So I think I've seen bigger lacerations in the last 10 years. I don't think we've really seen much changes overall in the knee injury rates or some of those other things. I certainly have seen, more overuse stuff, but it's hard to tease that out because as the academies have become more sophisticated, they're also training more. So you kind of got this off snow load, and then you've got this on snow load. So it's kind of hard to know, which of those factors is contributing most to what's going on. But I think we do all our, I mean, they have for a while, but we kind of all our coaches now, or almost all of them in Vermont, carry the stop bleed kits and those sort of things because you do see some pretty big thigh lacerations that, again, thankfully, mostly aren't dangerous, but occasionally they can be.
Yeah. All right. Fair enough. Stay safe on what will be a busy weekend on the mountain.
Cheers, everybody.
Thanks, Matt.